Before you dispense Oseltamivir, here's what every pharmacist must know about its side effects to keep patients safe. In this video, I'm going to explain 2 clinically important side effects of Oseltamivir. We will look at their mechanism, when they typically appear, and how healthcare professionals can manage them effectively. By the end of this video, you'll have a clear, practical understanding to improve your patient counseling and clinical decision-making. Let's take a closer look at these clinically significant adverse effects. The most common side effects of Oseltamivir is the gastrointestinal side effects, particularly nausea and vomiting. These reactions are usually transient, mild, and rarely require discontinuation of therapy. The exact mechanism isn't fully understood, but the side effects appear to be dose-related. They typically occur rapidly, most often within the first 2 days of treatment. Number 2, neuropsychiatric side effects. Although rare, Oseltamivir has been associated with neuropsychiatric events such as confusion, delirium, hallucinations, and in some cases, self-injury. These events are reported primarily in children and adolescents. The exact mechanism is unknown, but hypotheses include effects of Oseltamivir and its metabolites on nicotinic acetylcholine and monoamine oxidase A receptors, N-methyl D-aspartate and primary inhibitory neurotransmitter receptors, or dopaminergic pathways. Most neuropsychiatric events occur rapidly, often within the first 2 days of Oseltamivir initiation. With these key side effects in mind, let's move into the clinical pharmacy considerations and monitoring strategies for each category. Starting with the gastrointestinal side effects, here are monitoring points to ensure safer use of Oseltamivir. 1. Monitor for nausea, vomiting, and counsel patients that these gastrointestinal side effects are possible with Oseltamivir therapy. 2. Recommend taking Oseltamivir with food to minimize gastrointestinal discomfort and support better medication adherence. 3. Because these side effects are dose-related, pharmacists should be especially vigilant when patients are on higher doses or if the dose is increased at any point during therapy. 4. Evaluate whether these gastrointestinal symptoms are impacting the patient's adherence to the treatment regimen. Next, let's look at the monitoring tips for neuropsychiatric side effects. 1. Counsel caregivers to observe pediatric and adolescent patients for any abnormal behaviors and report concerns promptly. 2. Monitor for confusion, delirium, hallucinations, or other unusual behaviors, and assess changes in mental status or alertness. 3. Pay particular attention during the first 48 hours of treatment, when these effects are most likely to appear. 4. Consider high-risk populations, including children and adolescents, 10 to 19 years, as well as those with pre-existing psychiatric or neurologic conditions. 5. Be aware that higher doses may increase risk, and monitor patients accordingly. 6. Keep in mind that influenza itself can also cause behavioral or neurologic changes, including severe outcomes. Therefore, direct causation by Oseltamivir has not been firmly established. Awareness and careful monitoring of these side effects allow pharmacists to optimize Oseltamivir therapy safely and effectively. Thank you for watching. If you found this useful, consider subscribing to my channel for more clinical updates and practical tips.